2013 was a year of unprecedented change to the healthcare system in Vermont. Vermont created an online marketplace or exchange where sole proprietors, employer groups of up to 50 employees, and individuals who purchase health coverage independently would sign up for health coverage. Recognizing the challenge of this transition and the support that its customers and members would need, Blue Cross and Blue Shield of Vermont began planning for the change in 2010.
We realized that we were going to see the largest transition of Vermonters into new products, new rules, and a whole new way of purchasing insurance.
Guided by our mission commitment, we developed and implemented a broad and comprehensive outreach campaign to help transition Vermonters to Vermont's new health benefit exchange, Vermont Health Connect. Our new slogan became, "We'll see you through." And at the same time, operations staff at Blue Cross Blue Shield of Vermont began the massive IT project that was needed to integrate our systems with Vermont Health Connect.
Well, we started out by working with the state to define the requirements and understand how both the technical processes and the business processes were going to work. Once those were defined, we went off and did our programming and software development and process development, and the state went off and did its programming process and software development.
Early in 2013, Blue Cross and Blue Shield of Vermont began an expansive education and outreach campaign to engage Vermonters and provide them with information about Vermont Health Connect and support in their transition to this new way of obtaining health care coverage.
Our community meetings brought Vermont business owners and individuals together with Blue Cross leaders and exchange specialists.
At one of the community meetings we went to, we were actually able to sit down with a member and put in their income, put in their household size, and actually show them step by step really what they potentially could get for a reduction in their cost of insurance and what type of subsidy they would receive.
From the time that I went to our first meetings in Newport and in St. Johnsbury and then in Middlebury, I can remember driving away from the meetings thinking to myself, this can really work. This is going to be an extraordinary time in which the employees of Blue Cross Blue Shield of Vermont are going to really bond with our customers under our mission commitment.
I think overall that Blue Cross ought to be commended for the job that they've done. They recognized early on that this was going to be a process. Like I say, the first seminar I was aware of was Blue Cross and Blue Shield.
To reach out to all of the Vermont businesses and individuals who would need to enroll in Vermont Health Connect products, Blue Cross and Blue Shield of Vermont would need more than its regular sales force. To be able to see more Vermonters through the transition, the company reached into its ranks and began to provide special training to more than 36 employees who would be redeployed to the outreach effort beginning in the spring of 2013.
So we pulled together a cross-functional team and we looked at the different employees across the company. We tried to really evaluate where they had been, what their experience was, what their strengths and their weaknesses were, and we looked to create a team that would be well-balanced.
Before I became an exchange specialist, I was a communications writer, basically primarily writing, editing some of our publications. Sometime early in 2012, they were looking for volunteers to take part in this retail reassignment. I volunteered. I thought it would be kind of an interesting new way to learn even more about the company.
We went through a really extensive training process for people. It was very intense, going through a solid 3 weeks of training to train them on customer service skills, presentation skills, not only benefit training, but also all of the tax implications that were happening because of the changes for 2014. So people had to really learn a whole new skill set.
While I was gone, my communications department was down a staff member, so several staff members came in and stepped up and took over a lot of the work that I was doing, or used to do at that time.
We knew it was going to be hard for all the departments, that we're going to be losing people, and we don't have a big cushion. We're pretty lean. They were all willing to help, and they all really saw the bigger picture about what did this mean to our customers, and they wanted to do it.
For decades, Blue Cross and Blue Shield of Vermont's Blue Crew has staffed and sponsored myriad community events focusing on health and wellness in every corner of the state. In 2013, the Blue Crew changed its focus to include outreach about the health plan's products on Vermont Health Connect.
We have a team of engaged employees called Blue Crew, and that team in the past year grew to a group of about 50 people who regularly went out and worked in the community. We've always had a really strong community outreach program, and this year we refocused our events to meet the needs of people in the community who are dealing with the transition of Vermont Health Connect. Because we're a local company, we can get out into the community easily and do all sorts of events.
By the end of the summer, Blue Cross and Blue Shield of Vermont's outreach efforts were in full swing. The health plan had opened an information and wellness center in South Burlington's Blue Mall. The specially trained exchange specialists began to make and receive calls, and Vermonters attended community meetings, webinars, and other programming about Vermont Health Connect and the Blue plans offered there. Exchange specialists visited and called Vermont businesses to spread information about the changes.
We identified the small businesses that we wanted to reach out to directly. We split the team up and assigned a rep to each of those small businesses, and each of them went out and they contacted the group, they called them, they went over some of the changes over the phone, and then they actually went to their small business to meet with them, and then sometimes a second time to meet with their employees.
In order to give the level of service that we wanted to give to these customers and to get them through this transition with ease and the least amount of stress, we really wanted to make sure that when they called Blue Cross Blue Shield of Vermont, they were talking to a very knowledgeable person who was well-trained, who had the background, and who could answer their questions. And we just felt like our employees could do that best.
In May, Blue Cross Blue Shield opened the doors of the Information and Wellness Center in South Burlington. When we first opened, we were lucky to have 3 to 5 people a day, and since then we've averaged between 20 to 40 people a day, which is really wonderful.
Emily was great. She knows her stuff. She definitely had answers to all my questions.
Made it all sound very thorough and easy to understand.
My internal team has been wonderful. I couldn't have handpicked any better. The group of folks that I have, they're passionate, they take a lot of pride in their work, and truly I think they sincerely come across the phones and talking with the members that we care, and we're here to make sure that we see them through.
While the team of exchange specialists helped Vermonters understand the changes in the healthcare system, operational staff at Blue Cross and Blue Shield of Vermont worked with the state to launch the website and integrate it with systems at health plans like Blue Cross and Blue Shield of Vermont.
So initially we were supposed to start the testing processes with the state in July, and then July moved into August, and then August moved into September, and we were starting to get really nervous knowing that there was a 10-1 go live.
Despite all of the hard work on the part of the state of Vermont and the health plans, Vermont Health Connect had a rocky start. By November, it became clear that the shop functions that would allow small businesses to enroll employees would not be ready for the January 1 effective date. Once again, Blue Cross and Blue Shield of Vermont jumped to action to launch contingency plans requested by the state.
So one of the challenges that we experienced when the state announced these new options was, of course, all of this enrollment process was supposed to happen in an automated manner. So anticipating that, we had been gearing our staffing through the year, assuming that we would not be processing this kind of enrollment in the fourth quarter. So of course at the very last minute when these new options were announced, it was very challenging for us from a staffing perspective because we were not staffed for this additional work. We had employees who worked hours and hours of overtime on the weekends, on the evenings, of course just prior to the holiday season. The state had folks doing the same thing on their end, processing manual applications, while we were here on our end doing similar type of work to make sure that everyone was into our systems prior to 1/1.
As 2013 drew to a close, Blue Cross and Blue Shield of Vermont employees were still hard at work making sure that their friends and neighbors would be covered in the days ahead. As Vermont Health Connect chose additional contingencies, Blue Cross and Blue Shield of Vermont enacted those and developed strategies to make sure members could have access to care even when the contingency plans failed to provide them with coverage.
We have customers now who are calling in who have enrolled through Vermont Health Connect, but we had not yet received their enrollment, therefore they're not on anyone's system. We're able to put these members in the Access to Care plan, and they're able to get their prescriptions that they need.
Right after January 1st, we had a new member that called up saying he had to go to the hospital for a procedure, and he didn't have his ID card yet. It was just about to arrive, but he needed it. He needed some proof of coverage that morning. So I called up the hospital. I said, here's the deal. What do you need? I faxed him the information.
We've known from day one what we wanted to do, and that was to make sure that our Blue Cross Blue Shield of Vermont members weren't left without coverage. Everyone knew that goal from day one, and everyone worked together to make sure that was happening.
Really, this is an initiative that has affected almost the entire company. I can't think of any department that really hasn't been affected by this. And in some ways it's been nice because it's brought us all together in many ways.
I would have to say that I think this is one of the biggest, if not the biggest, change that I've seen here at Blue Cross and Blue Shield in the 30 years that I've been here. And also altogether collectively, like a huge company-wide group team effort.
I've been at Blue Cross and Blue Shield of Vermont for 15 years now, and this is by far the most challenging time that we've gone through, but at the same time the company has never been stronger and more supportive of our members.
I've been at Blue Cross Blue Shield of Vermont for 8 years.
14 years.
19 years.
Almost 3 years.
I've been here about 16 years, and I have to say that I've never seen an initiative like this.
And I'll never forget one of the members in one of our focus groups stood up and said, "I've got a terminal illness. And when I was diagnosed with my illness, I thought the insurance company was going to be my adversary, that they had my back every step of the way." And I think if I could sum up our campaign, that's it. We've had the back of every single Vermonter out there that had to go through this transition.
I'm convinced that our outreach campaign was a complete success. I'm able to draw this conclusion because at the height of the campaign, I received myriad compliments and expressions of gratitude for Blue Cross Blue Shield's support to customers and our role in the exchange transition. And as I reflect on these conversations and letters, I note that they were never about our strategy and seldom about our new programs and services. They were always about Blue Cross people, so knowledgeable, tirelessly helpful, and above all, committed.
Our team is an incredibly professional one. We've got a discipline, we work hard, but probably the most impressive thing about our team is how much we care.
It's all very confirming of my own beliefs and the basis for our culture, that people always make the difference. Or as I say frequently, it's all about the team you put on the field. And I'm very proud of our team and privileged to count myself among them.
Blue Cross and Blue Shield of Vermont. We'll see you through.